Welcome to a special virtual edition of the Skeptics track at Dragoncon. Make sure you are prepared for another hour of critical thinking.
Hello and welcome to the live streaming Skeptrack from Dragoncon 2020. I'm Dr. Angie. I'm the assistant director. Hello, welcome. With us tonight we have Dr. Dan Ketterer, who's an infectious disease doctor, who will hopefully shed some light on how we can keep safe once we do return to meeting and meet space. Hi, Dan.
Right.
How you doing?
Hey, what's going on, Angie?
It's good to see you.
How's it going?
Fantastic, fantastic.
All right. Do you like my green screen in the background? It looks like a house that never has been painted and has no decorations.
Well, it's you written all over.
Yes. Yeah. I mean, it took me forever to get this effect just right.
To
make it look like a house that's barely been lived in.
Time and effort well spent.
That's right. That's
Good
right.
job. Okay, before we went on, I have been saying that I had low expectations but high hopes for meeting in person for Dragoncon next year, and you said that you have high hopes and you expect that we probably will be able to. Tell us about that.
Yeah, I think we will. I mean, I did have that caveat that we're going to have to move the con to New Zealand, but...
Oh, well, that's true.
I'm somewhat hopeful by next year we will have a vaccine, but the question is, who is going to receive said vaccine, which vaccines are going to make it through, and which ones will be the most efficacious. But the other thing that makes me hopeful is the folks who attend Dragoncon, I think, will have a safety-minded approach to it, and hopefully people will check out my guide. I have a guide for the public, which you can check out at drdansguide.com, which I just put up today, finally. And it will give you some good tips as far as how to best stay safe when attending public events.
So drdansguide.com.
Yeah.
Okay. All right.
drdansguide.com.
Okay, good. I want to make sure that we say that a couple of times. That's going to be important.
I can just put it in the chat if people can see it. Can people see the chat?
No, I'm told no. So someone is shaking his head furiously to my right. So I'm going to go with no.
Okay.
So, but if anyone does have questions, they can post in the chat and we can ask questions of Dr. Dan.
Yes.
So, all right. Well, so tell me what you're seeing. And you're an infectious disease doctor here in Atlanta.
Yeah, that's right.
Tell us about your experiences during all of this.
Gotcha. So I was one of the folks in basically the front line. I started a brand new job at a brand new hospital right as this started. And my very first day, I set up a meeting with the hospital administrators to try to get them prepared for it. And just right from the very beginning, I saw from the medical community, their approach to this was, one, try not to panic. And then two, they were trying to influence local government, which I don't know if you know, especially in the Southeast, it didn't really work out very well. So from my standpoint was, we have to try to educate the public first and foremost. And by doing that, we can reduce the number of cases, we can reduce the load on the hospital, we can reduce the need for vital resources like ventilators and supplemental oxygen. The key to ending this, especially if we are going to end it before we have a vaccine, which is actually somewhat possible to get to just a very low level before we have a vaccine, is through education.
Okay, well, so what should we be pushing? I mean, like we've been saying, so physical separation, wearing the masks, washing of the hands. And those seem to be the big three. So are you in agreement with that? Is that the order you would put them in?
Yeah, I mean, the top one, if you check out my guide, I'm gonna say, like, reference my guide a million times.
That's okay.
I have 4 things in there. So the first one is to distance yourself. And the exact amount of distance isn't really known. It's kind of arbitrary. So in the US, we're using 6 feet. Over in Europe, they use 3 feet. But what's really important, though, is the time that you're in close proximity to someone. And part of what I try to do in my guide is to try to reduce anxiety that people have about this by answering some of the most common questions. And when people go back and contact trace, what they're looking for is if you're in close proximity to someone for more than 15 minutes. So it's not going to be that person who just ran by you with no mask that's going to infect you. It's going to be typically someone you've been in close proximity with for a decent number of minutes, which is why when you see transmission occurring, it typically occurs in someone's household. But my big 4 are socially distance, like we talked about, wear a mask, but use eye protection as well, which I think is something that's often neglected. Sanitize your hands frequently. And if you ever are concerned that you may have contacted something that you think may be an infected surface, don't freak out, but don't touch your face. Just go wash your hands. And then the fourth thing is if you start to feel sick, is that you stay home and self-isolate.
Okay. So as far as eye protection goes, are glasses acceptable, or do you have to do the full face shield? Because I'm seeing folks like that. No.
I actually typically don't recommend face shields for people because they fog up. They don't work outside very well. If people want to use eye protection outside, any sort of wind or breeze will mess your face shield up. What I do recommend, I don't have it with me right now. Later on, I could just go downstairs and get it, or you can just check out the guide where I have a photo of it. I tell people to get the cheap safety goggles from Home Depot. These are these really lightweight plastic ones that look like wraparound Oakleys. They cost about $1, and you can clean them. And what's nice about them is they have a decent seal around them. So, I think for most people, your regular prescription glasses like you have is okay. But especially if you're going to be taking care of somebody or someone in your family has coronavirus and you need to be near them to help take care of them, having that sort of wraparound style where it doesn't really have too much of a gap may be a little bit safer, in addition to using masks and making sure you're cleaning high-touch surfaces frequently.
Right. In the emergency department, I'll often use the wraparound style in addition to a face shield if I'm doing any kind of invasive procedure, if I'm intubating, something like that. So, but that's sort of a special scenario. I mean, people aren't recreationally intubating, so that's not that's not really a concern. I think most people. Okay, well, you maybe, because I know you pretty well.
I'm just hold still while I paralyze you. And,
okay.
And then that's a successful first date.
Well, that's a fair point, but for the rest of us, for the rest of the folks, that's sort of an overkill.
You know what else is an overkill? The public wearing N95 masks.
I was just about to ask that very question. So talk to us about masks. Talk to us about P100, N95, and all the other stuff.
Yes. If it has a letter and a number, don't use it. For the public, it's not necessary. And even in medical situations, the places where we reserve it is, like you were saying, if you're doing a medical procedure that has a high risk of aerosolization. And again, you don't have to remember all this. All this is in my guide. There's specifically a level 2 learning section on airborne precautions. I suggest everyone check out. But from the very beginning, I've been giving out the advice that an N95 is not necessarily the best type of mask you want to wear. But there is a hierarchy. And I think it's important that people know this, and it's not something that's been really well disseminated. The best type of mask you want to wear is the sort of disposable, either a procedure or surgical mask, over the cloth face mask. And there's a bunch of reasons why I make that recommendation.
And not the other way around.
What do you mean?
Like putting the paper one close to your mouth and then the cloth one on top of that.
I don't think that's necessary, honestly. Okay. Yeah. So you have to balance things, right? So you have to balance your ability to breathe, and you also have to balance the sort of complexity of your personal protective equipment. So with the N95, yes, it does technically filter a little bit better than one of the 3-ply disposable masks does. However, an N95 is only as good as the fit test is.
Yep.
So if you're not getting this special thing called a fit test, which is something folks like Angie and I have had done, you may not be getting a good seal on your N95. The other thing is an N95 is not really designed for extended use or wearing for a prolonged period of time. What ends up happening is if people are wearing that out all the time, they have to adjust their mask more frequently when they're wearing an N95, and that could incidentally lead to them touching their potentially contaminated mask and inoculating their eyes.
And they often end up wearing it around their chin anyway, so that's completely useless. What's the point? Right.
So the sort of preferred mask type is to use one of these 3-ply procedure masks. And here's why. So first of all, the way these masks are constructed, the middle layer of the mask is a sort of blown plastic, almost like fiberglass. And the way that mesh is set up is that the fibers of the mesh just go in all sorts of different directions. And that sort of mesh where it's going in different directions acts like basically taking out all the holes out of Swiss cheese. So it does a very good job of blocking material coming from the inside or from the outside. So the purposes of masks are threefold. There's 3 purposes to masks. Most people think that there's 2, but there's actually 3. So the purpose of the mask is if you yourself are infected, and you may not necessarily know it because you can be either pre-symptomatic or asymptomatic, it's to keep your infected respiratory droplets from getting into the outside environment and infecting someone else. Masks also help the person wearing it from being in contact, at least from the oral route of being exposed, oral and nasal route, as long as people are wearing it over their nose, from being exposed to the virus at a level that will cause infection. But the third method that people don't really think about very much is it works via signaling to other people that may not necessarily be wearing masks that, hey, I am concerned about the spread of coronavirus. You should wear a mask around me. You should social distance. So it works via signal theory as well.
Yep.
So,
and it normalizes it, not just the signal for immediate, but it also normalizes it so that people who may be sick are more likely to wear a mask for that context as well. So it's sort of an offshoot of what you just said. But you mentioned about wearing the mask under your nose. I cannot tell you how many patients I have had say to me that they're wearing it under their nose because they have asthma. I contend the only good reason for not wearing a mask is if you don't have a head. If your breathing is that delicate, then you should be in the hospital. Now, there are, of course, there's some people with severe developmental problems, or they're very, very young children. That's a different issue. But adults, in general, that is my contention. Am I wrong?
Yeah. So if you look at the actual guidelines, everyone over the age of 2 should be able to wear a mask. And if you have asthma, making sure that you're taking your you're using your inhalers beforehand and pre-treat, I think is really important. Now, and one thing I talk about in my guide that's I don't think has really been disseminated in the news at all is, okay, let's say you're at Costco or you're looking online and you want to sort of shop for the best sort of mask that's going to work for personal protective equipment. So there are ways to sort of tell the difference between them. So there's a society that rates masks based on their ability to essentially keep droplets out. So I believe it's the ASTM. And what you're looking for, there's 3 levels of this ASTM. There's 1, 2, and 3. The higher levels give you more protection. And in my guide, I recommend that people look for a mask that has a level 2. And the reason I recommend level 2 is in the original SARS coronavirus epidemic, that was found to be the most efficacious mask. So there are differences between these masks. And I think that's really important that people realize it. And another important thing is you can absolutely reuse these masks as long as they're not contaminated, visibly contaminated, or wet. Once they get wet, they do not work very well. And one of the methods I recommend for people to help sort of decontaminate their masks is to put it in a paper bag, some sort of breathable bag, label the date you wore it, and then just set it to the side. Coronavirus is inactivated over time. And in my guide, I've had other physicians peer review this, and they agree. They say the amount of time I have is maybe overkill, but I recommend people just put it in a bag and wait 7 days. And the 7-day recommendation came from a study that showed that 99.9% of the virus was inactivated after 7 days.
We were issued the N95 masks, and we were told to put in the plastic bag, and we're supposed to rotate every 5 days. But many of the nurses and doctors have like P100 masks that we clean in between. What do you think about those? Because we just don't have the equipment in a lot of places. I'm bringing my own Clorox wipes because we just don't have any.
Right. So in the guide, actually, I talk about how you can make your own bleach wipes, but regarding the P100 masks and things like that, you have to balance off the comfort level and the ability to actually clean and reuse your mask with that. So, for the most part, even in the hospital, I recommend just using the disposable surgical masks or the three-ply masks. With the only exception is, in your case, if you're having to intubate somebody. But studies have shown that in hospitals, thankfully, in hospitals where there have been places and times where people have had sort of a widespread exposure, like in someone was being intubated and just started coughing and that person was coronavirus positive. It didn't matter if the medical personnel in the room was wearing an N95 or a surgical mask. They both kept the persons wearing them from being infected.
Well, that's reassuring.
Yeah.
Appreciate
so a lot of what I talk about in the guide is meant to reassure people.
Yeah, that is reassuring.
I try to write it in a way that can be understood at a 6th grade level. And then at the same time, have a little clickable drop-down box when people want to know more. Like, what is the rationale behind things?
Well, that's a relief because even an emergency doctor can understand that, right?
Yeah. So one of the ways I think we can help stop the pandemic early, I have a methodology that I had from the very beginning. And I think comedy, that's why this is called coronavirus or COVID comedy and cons. So we've already talked a little bit about we'll talk more about con safety. I don't think we went into it enough, but I think comedy actually can help end the pandemic. And the way that is it doesn't matter what political ideology you are. I mean, science is not political. There is no side in politics for science. But satire and comedy, I think, can be used as a tool to help educate people. And in my guide, there's a new sort of project, something I've been working on for quite a while, I call it the cosplays, which is coronavirus open source plays project. And what it is they're coronavirus public service announcements that are all short comedy sketches. And they're all based off of different things about the pandemic. Like there's one about like the proper way to wash your hands, which 99% of people aren't doing, which is based on the WHO clean hands procedure. There's ones on herd immunity. There's ones on vaccine hesitancy. And the idea is I made these skits open source so that people can make them and share them. There's even one about, it's kind of like a coronavirus meets Smash Brothers sketch. And the idea of all of this is get people to make these sketches, link people to good information, and you may feel like you have a family member or somebody close to you that you just cannot convince them otherwise. They are already very sort of set in their head of what their beliefs are, and they don't listen to you. But the reality of the situation is that person probably listens to somebody. It's just not you. And what you need to do, and the goal of this project, is to influence the person that the stubborn person listens to. You only have to get to them. And if you get to them, then they may trust that person more and say, hey, look, I saw this funny YouTube video. I clicked on the link at the end. It had some really easy to understand information that was pragmatic. They may not use those exact words. They're not showing up in a smoking jacket and a pipe. They're like, I just read some very pragmatic information about this pandemic. And I think I will incorporate this into my lifestyle choices. No. You make it fun. You make it silly. You make it stupid. You get the kids on board. And I think it will kind of end a lot of the despondency and despair that people have. Is, we all feel like we need to laugh right now, but at the same time, we can laugh and have purpose. Like we can bring an end to the pandemic before there's a vaccine. I think that's important for people to realize.
Well, I sure hope so, because it sounds like a whole lot of people that need to be vaccinated. So hopefully that's true. Yeah,
and I talk. A lot of this stuff is going to be in the guide, so don't feel like you need to remember all of it. Just check out the guide later. drdansguide.com.
drdansguide.com.
Yeah, we'll repeat it like 50 times.
At least 50 times. Yeah, and we'll provide links. So now, there was a question here.
One question from
here on the thing. So
are literally dozens of viewers, or how many viewers do we have?
19 right now.
Over a dozen. Okay, not dozens. Our dozen.
Well,
viewers.
But here's the thing, though. It's going to be preserved, so people can come back and watch it later.
Oh man, I guess I should have put pants on.
As long as you don't stand up, we're fine.
What? Oh, what?
No. Okay. So, if masks are not recommended for kids under 2, wouldn't that put a child with an immature immune system at higher risk? That was the question.
So, the thing about kids, and I talk about this in the guide, is kids, when they're exposed to this virus, are far much less likely to get very sick or die from it.
Now, they still do, though.
They do.
They absolutely still do. Do not get the impression they don't. But I'm sorry, go ahead.
When you look at the overall stats,
yes.
When you look at the overall stats, kids, especially under the age of 13, tend to do the best. Mm-hmm. So that is not to say that they can't get infected, nor that's also not to say that they can't infect you.
Yep. Or grandma who's undergoing chemo for cancer.
Right.
Yeah, or anybody else. Yes.
Absolutely. And there are several kind of hypotheses to why kids don't seem to get as severe infection. None of these have been absolutely confirmed at this point. Kids do have a reduced number of the receptors that the virus uses to attach itself and enter into cells. That could be part of it. Part of it may be that kids are exposed to other coronaviruses that cause colds more frequently, and there may be some cross-protection of antibodies. Mm-hmm. It's not exactly known. But if you do have young children, I mean, I'm not really sure if a mask for kids under the age of 2 exists. So I'm not sure how you're going to be able to safely put a mask on them. So that's problem number 1. But what you can do is teach young kids how to wash their hands and teach them to social distance. I talk about this in my guide. Most of the transmission occurs in families. Mm-hmm. Your ability to protect yourself and your family is only as good as the weakest person in your chain. Yeah. You cannot stress that enough.
Yep. So, okay, so what are the stats now? Because I mean, I know what I think they are, but tell me what they go. They went from what to what with, like, even with someone who's positive, the unprotected, what is the rough transmission rate within a household?
Yeah. So it's unprotected, like doing everything wrong.
Yes.
Yeah. So
it's still not 100%.
No, of course not. Of course not. So
well, I knew that, but I want you to say it so other people hear it.
Yeah. I mean, one, it absolutely doesn't, like the absolute hard percentage doesn't matter.
No, that's true.
It doesn't matter. If someone is infected, you need to be doing everything you can. Like, and if I tell you that the percentage is about 17 to 20%, which is what we call the attack rate in households, you can mitigate that. You can drive that down.
Yes.
And that is what it is. But you can drive that percentage down by making sure that everyone in the household wears masks, that you're cleaning high-touch surfaces frequently, even though fomite transmission is much, 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 much less at play than respiratory droplet transmission is. And you can drop that risk substantially. Right. Substantially. So early on, so that percentage is based off of the early China attack rate. But when people took precautions, when they started having universal mask wearing, when they were cleaning high touch surfaces and social distancing, that percentage rate dropped to under 5%.
Well, and that's not a hard saving throw to make.
Yeah, it's really easy.
Yeah, I mean, you can make that saving throw. I mean, you may lose, but at least, you tried. So that's why it's so important.
Yeah. So, and Angie, you kind of stopped me about kids die from this, and
sorry,
that's true.
Do it.
That's true. So I just so happen to have the MMWR stats by age group of deaths put up. So we're talking death here, death, nothing else.
Not
death.
Morbidity, but we're talking about mortality.
Yeah, absolutely death. So if you look at ages 0 to 24, there's been in the United States 357 deaths, and that was out of a denominator of 169,044.
Ages. What are the ages?
That was 0 to 24. 357.
Okay, all right, gotcha.
Out of 169,000 deaths. So it happens, but it's still
common,
fairly rare.
True. Yep.
And I want to talk a little bit about the 94% of people having comorbidities thing, because when I heard this, I just couldn't stop laughing, and most medical people couldn't stop laughing about this. This is
hilarious. Y'all gotta hear this. This is hilarious.
That is hilarious.
It's hilarious.
It's so funny.
Go.
So people, I don't think, understand how medical billing works, and that explains the 94%. So when they say that 94% of people had some other medical issue, this includes obesity, this includes diabetes, this includes hypertension, this includes a history of heart disease, a history of heart failure. It includes any history of any respiratory disease like asthma, COPD, structural lung disease, history of cancer, any of these things that are in there. So they looked at coding for people that died. So during their hospitalizations, hospitals put in codes, and these codes are used for billing. And when physicians see patients, typically we try to describe all of the different comorbidities a patient has in these codes, because having any of these comorbidities increases your risk of a worse event happening during your hospitalization or your disease being worse. So they're all used as descriptors, they're all used in billing. So in that 94%, they just looked at people who had no other codes but COVID-19, and pretty much any doctor worth their salt is only going to just put that one code in, especially if they die. If they were sick enough that they died, they will have more than likely some other complication. And many of these complications are extremely common in the general population. Extremely common.
Right.
So to say that, the 6% of people that died from this, they had some other underlying illness that was severe. Nope, it can be as easy as high blood pressure or just being overweight. that counts. And that is put in the billing codes. And the other thing that it isn't taking into consideration is people who had to go to the ICU, were in the ICU for a prolonged period of time, now have things like pulmonary embolisms, blood clot issues, heart inflammation, like long-term sequelae from this, and they just survived. They're not including in that stat the people who had prolonged hospitalizations where they are, for the most time, alone. They can't see their family. That's not in the stat. That is not being captured in the stat. And medical personnel are getting better at treating coronavirus, but we're still losing 1,000 people a day from those, even with the advancements we've made. And just to say that, it's the probability of dying from this is so low, you're not taking into account the missed days of work, the missed income if you have a mild disease. And if you are unfortunate enough to require hospitalization, typically a prolonged hospitalization where you may have to be on supplemental oxygen, you may have to have a breathing tube down your throat, you may have to be paralyzed, and you're not even on a date with me. And
well, and it's not
it's
just
a horrible thing.
Yeah.
I mean, it is a horrible and lonely experience.
And it's not even like being on the ventilator, the breathing tube, and all for like the 4 or 5 days that you would expect from like influenza.
No,
people are on it for weeks.
Yeah, and I mean,
and
the settings that they're on too. We're this is total doctor talk here, but
sorry,
I mean, we're not going to get too off track here, but. The settings you typically have to use are they can cause some serious lung damage. They can cause the sac around your lung to develop a hole, and you develop something called we call a pneumothorax, where your lung no longer expands because we have to use so much pressure.
Yeah. It's like you pop the lung and you drop the lung, and then you got to put a chest tube in. Now you've got risk of infection, not only from the tube down your throat, but the tube in your chest. I mean, like it just and then you've got scar tissue that develops. Assuming you survive all of this, then you've got lung that doesn't work. You've got a tube that's been in your lung. You can develop infection in that airspace, or that space that's not airspace, the space between the lung and the chest wall that requires drainage. You get an empyema, which is a collection of pus in
secondary infections.
Yep, and then you have to have separate treatments that cause the lung to scar to the chest wall. It's just a mess. You don't want any of this.
Yeah, I mean, and I've seen people of all ages get this. I've seen 22-year-olds with no other medical problems be in the ICU for a month. It's just like rolling a D20, I guess. Yeah. Sorry, that was a nerd reference. I know I'm talking to nerds.
Yeah.
So
well, I already talked about a saving throw.
I looked at my notepad. I'm like, put at least one D20 reference in there.
Well, I already referenced a saving throw, but Dan, that's not funny at all. That's not funny. Those things are terrible. Oh, we have a question. So, can you talk about the difference in how much viral load you get and how that translates to how sick folks are getting? And that's a really good question because a lot of medical folks were dying early.
Yes, that's correct.
So, talk about that, please.
Also, absolutely in my guide. So, there is a theory. It hasn't been fully confirmed, but that.
We call those hypotheses.
Yes. It's just very hard to test this.
Okay.
Because you can't ethically test this hypothesis without, risking someone's health or life. But there is a hypothesis that many of the younger individuals, younger physicians, younger healthcare workers that were exposed to the virus early on, before they really understood what they were dealing with, that ended up dying. And when they had no other comorbidities, it was due to what we call the infectious dose. So, meaning that they were exposed to a higher amount of virus completely unprotected, which again emphasizes the importance of face masks. And from an infectious disease standpoint, we don't know what this number is right now. So what by number, I mean how much virus is necessary for someone to get an infection. And I talk about this in my guide. That number is going to vary based on your age, your immune function, meaning Are you on medications that may suppress your immune system, like if you have cancer or you're taking medications for rheumatoid arthritis that may suppress your immune system response? There's all these different parameters, but there is a certain amount of virus that you have to be exposed to develop COVID. So what the first thing I talk about in my guide is you have to separate these terminology out because that's really important. The virus is called SARS coronavirus 2. The disease that it causes is called COVID-19. You don't get sick with COVID-19. Another analogy in the virus world is HIV is the virus that causes the medical condition known as AIDS. You don't get infected with the AIDS virus. You get infected with HIV, and it can cause the AIDS virus. So you can be exposed to SARS-CoV-2 at a lower level, and it's not enough for it to have a sustained infection where you develop COVID-19. And so that is the point of distancing and wearing a mask and washing your hands. It's to lower that amount of virus that you're exposed to keep you under that infectious dose threshold where you don't develop COVID-19 and you're hopefully not spreading it to other people.
Is that exposure high enough to cause formation of antibodies?
Yeah, that's a good question. I don't necessarily think we know at this time. You may develop some antibodies. So I think this is important also to take into account. You shouldn't rely on antibodies to provide you for protection against reinfection. So a couple reasons for this. So we can test right now, we can test your blood to see if you have antibodies against SARS-CoV-2. And there's different types. There's one called IgM, and then there's one called IgG. Typically, IgM forms early, and IgG forms later. And think of antibodies like a lock and a key. So your pathogen, be it a virus or bacteria, is your lock, and your antibodies are the key. And it has to be a certain shape. So your body tries different sort of permutations to see if it can find the right shape. And there's different types of these antibodies, meaning their function is different. One of their functions may be to tag a pathogen and tell your immune system, hey, pay attention to this and try to eat it. So you have these special immune cells that will come and eat pathogens. They're types of white blood cells, and they'll more effectively eat those pathogens if they've been labeled with antibodies. And then another type of antibody will actually bind to the virus or bacteria, in this case, we're talking viruses, and keep it from attaching and infecting cells. Because viruses on their own don't divide. They have to hijack your cells. They have to invade your cells and hijack your cellular machinery to be able to complete their life cycle. So if these antibodies can attach to the virus, keep them from binding, it neutralizes the virus, which is why they're called neutralizing antibodies. And going back to the IgM and IgG, typically IgM forms early and represents kind of like a shitty ass key, like the kind of key that breaks off in a lock. You're like, this key sucks. They typically don't work very well, but they're
enormous and they don't cross the placenta. Yeah.
Right.
Okay.
So, and then over time, you develop like the more precise key, which is IgG. Now, in SARS-CoV-2, something very interesting happens. Typically, IgM forms early, IgG forms later, but not in this. They actually rise at the same time. And the rise can be as early as 1 week. But if you're doing antibody testing, you want to wait until 4 weeks after symptom onset before you check for antibodies. And the reason for that is your probability of false positive or false negative tests is pretty high before that. So the other thing is, though, the antibody tests, I made it a point to talk about what we call neutralizing antibodies, which are the types that attach to the virus and keep them from invading the cells and keeping them from copying, versus the other types of antibodies that signal your immune system. The tests don't differentiate between the two. And it's thought to be that the neutralizing antibodies may be the more important ones. And with our testing, as it is right now, we don't know the amount of neutralizing antibodies that are formed. We don't know how much of it is necessary to prevent reinfection. We don't know how broad they are. Like, will it work against a coronavirus that has mutated enough to prevent a reinfection? And there's already been one well-documented case of a person who had been infected and then was reinfected several months later, which is why it's so important to not rely on herd immunity. And even if you had the disease already, we're probably going to still have to vaccinate you for this.
So that person, do we know if that person was it just testing positive, or was it an actual full-blown syndrome that they had a second
time? They had
time?
COVID twice.
Wow.
And the way it was actually a really well done case, because they had the first time around isolated the virus and taken its genetic material. They had taken the genetic code of the virus. The second time the individual had COVID, they did the same process and found it was a different strain of the virus.
Oh, so the zombie apocalypse is not over. Oh,
but
man.
At the same time, it's really important, because I think there's a lot of questions people have as well. Does the virus go latent? Does it reactivate? And there's no evidence for that whatsoever.
No, coronaviruses are not that type of virus, are they?
Right. They're not.
They're just not that type of virus.
Yeah, they don't have a latency phase.
Yeah. Okay.
Right.
So we did get a question from the chat. Now let's see here. Do you know any information about blood oximetry? I assume they mean pulse oximetry.
Pulse oximetry.
Or blood clotting as a symptom. Is this common or not? So I think they must be referring to the vasculitis and the inflammatory processes that tend to be procoagulopathy.
Yeah. So it's very detailed, and again,
sorry.
Look in the guide. No, you don't have to apologize. But with this disease, we see, some call it I call it biphasic. Some doctors call it triphasic, meaning it's just a fancy term for multiple phases, either 2 or 3 phases. When the folks who are calling it 3-phase typically include the sort of middle part where people have recovered. They count that as a phase. I don't. So I think of it more of as a biphasic illness. So the first part of COVID is usually marked by certain symptoms. And those symptoms are fever, shortness of breath, low oxygen. But there's other symptoms too, like loss of taste, loss of smell, GI symptoms.
By which you mean nausea, vomiting, diarrhea, belly pain, kind of symptoms.
I mean, those things can go in there too.
But right, but that's what GI symptoms are. Not everybody knows. We're kind of geeking out a little bit. We kind of start speaking in shorthand because we know what we're saying.
Pull us back, guys. Pull us back.
That's right. That's right.
Yeah, exactly. So those symptoms predominate in the first 10 to 14 days. Then people typically, as long as they're not having develop severe COVID, will have a recovery phase. Then some people will go on to develop a second phase. And in that phase, that's where you start to see things like blood clot formation. You start to see inflammation of the heart, which we call myositis. You can see liver involvement. It can infect almost any organ system. It can infect the kidneys, for example. And what we think is that first phase of the illness is primarily due to the virus itself, or what I like to call viral cytopathic effects.
Meaning the actual effects of the virus on the cells.
The virus.
Okay.
Yeah, exactly. Then your immune system and inflammatory system ramps up, decreases the amount of the virus to the point where you're no longer transmitting it. And that usually occurs about 10 days after symptom onset. That second phase is more than likely caused by your own inflammatory and immune system response. And this is not the only virus that this occurs with. This is not some magical thing. Right. This is why influenza kills so many people every year, and why everyone that's watching this should go and get their flu shot.
Get your flu shot. Please get the flu shot.
Yes.
Please.
Yes. They are available now. And I got some in my jacket right here for sale. No, only $29.99. What a deal. No, if you live in the Southeast, you can go to like Publix, you can get a flu shot, and I believe they give you a $10 gift card. And if you mention my name, I get $25.
No, don't do
that. That's right. So
no.
influenza also does this. So influenza, part of the reason it kills so many people is that period after influenza, you are much, 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 much more likely to get a heart attack, a stroke, a blood clot in your leg that can go to your lung. All viruses that infect humans are pro-inflammatory. And this is something infectious disease doctors hammer over and over again, which is why it's so important to get vaccinated.
Yeah, and those effects can be up to 6 months.
Yeah. The effect,
I saw it set up to a year.
Maybe it's 2 years. No, come on, Angie.
No. I mean, like the study went over a year. It was much more in less than 6 months, but.
Right. Yeah, I mean, we typically look at 6 months, but in that immediate period after infection with the virus is when you're at the highest risk. And not to get too off, because I think this is really, 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 really important. When are people most likely to transmit coronavirus, or SARS-CoV-2 in this case? So the sort of viral load, the most infectious someone is in the 24 to 48 hours before and after they show symptoms. That's the time they're the most infectious. So that's why it's so important that even if you feel okay, that you're wearing a mask when you're in close proximity to someone for a prolonged period, because you may still be in that pre-symptomatic time period where you're extremely infectious. You just don't know that you've been exposed.
Right.
Yeah, and because the title of this says cons in it, and it's not because I'm here to con you out of your money by getting referrals from Publix, that's definitely not a con. No, I want to talk about safety at cons.
Yep.
And how people can be the most safe. So one of the things, and again, reference the guide, I would look specifically at the section on my guide. There are mini guides, and there's
where can they find that again, Dr. Dan?
Why? You can, it is on the World Wide Web, which is this brand new thing. I learned about it at the library.
It's on the inner tubes, yeah?
Yeah, I learned about it at the library. I watched a VHS tape, and they talked about the World Wide Web. Wow, it's so exciting. I've only been using BBSs. So it's at Dr. Dan's Guide, and it's important. There is an S there, DRDANSGUIDE.com. Once you're there, you'll have the main guide right in front of you. So much great content. I have ASMR videos. Yes, that's the relaxing sounds of infection. Where I teach you things about coronavirus for you to go to sleep by. No, it's true.
Okay, well, how do we stay safe at cons then?
Yeah, so staying safe at cons, go to my site, look up the section specifically on travel, because a lot of that is going to be applicable to cons. Because in the travel section, I talk a lot about how you can choose sort of the best hotel, and once you're at the hotel, what precautions can you take? So making sure that you're staying at a hotel that actually has things like hand sanitizer stations set up that are requiring mask usage for all guests when they leave the room. And more importantly, not only are they requiring it, but they have some teeth to it. Meaning if someone is being, flagrantly violating this, not wearing a mask, not social distancing, that they're going to throw them out. Like, it's important that you have some sort of teeth to it. So when you're picking a hotel for Dragoncon, I know they're the official partner hotels, ask these questions. If enough of us are asking these questions and say, this is extremely important to our staying here and giving you our money, people are going to start to do it. It works off the greed and signal theory. So look at the guide, look at some of the questions as far as what you should be asking the hotel. The second thing is at a con, figure out how to incorporate a mask into your costume. I'm trying to think of almost all superheroes wear some sort of mask. So yes, you can incorporate a mask into your costume. The other thing is at a con, it is, I think, a little bit easier to use hand sanitizer, but let's say you don't have pockets in your, Spirited Away costume when you're going as No Face, right? No Face doesn't have pockets. Just go wash your hands. It's just as good as hand sanitizer. And if you think you've touched a high contact surface like the disgusting elevators at Dragoncon, the elevator buttons, for example, make sure you wash your hands before you touch your face. So I'm trying to think what else would be really important. And remember,
always, no, never.
Prolonged. Remember, the risk is never zero.
Yes.
Your risk is never zero. So, which is why in these guides I talk about safer, not safe. Mm-hmm. If you are not hermetically sealed in this amazing green screen empty room like I am, your risk is always going to be over zero. But that doesn't mean there aren't things you can do to reduce your risk.
Well, that was very well said. Very well said. And where can people find you?
So drdansguide.com. There you can see, I'm on Twitter, I guess. I have 2 Twitter friends. I think I've logged in twice, but I'm Pus Doctor. I'm Pus Doctor on Twitter. I have a great Twitter handle for someone who doesn't use Twitter. I'm also on Facebook. I have an account there as well. Daniel Ketterer. Find me there.
Yep, but drdansguide.com.
Yes, that's the best. That's the best way.
Information that we've talked about.
That's right, and you can check out the cosplays. And please, please, please make the coronavirus PSAs. Make the comedy PSAs. Share them with your family. You will love them. Just read them. Read them. See what you think. You'll love it.
Well, thank you so much for joining us, Dr. Dan. We really
thank you to the dozen of people who watched this.
Well, and there will be more in the future. This is going on the internet where there is no such thing as going away.
That's right.
There's no deleting the internet. So
we may get up to 24 people watching this eventually.
You might. You very well might. And listen, if that's 24 people that you've saved from something silly like SARS-CoV-2, then
as long as they're not assholes, I'm cool with that.
Well, even assholes deserve protection, so here we are. So anyway, so thank you so much for joining us on the live streaming Skeptic Track for Dragoncon 2020. Thank you, Dr. Dan. We appreciate your joining us. Thank you to Calico Cove Studios for giving us this lovely space. Thank you to the crew. Thank you, Derek, everybody. Thank you. We'll see you tomorrow.
As fun as all this streaming content is, we sincerely cannot wait to see you all in person again next year. Remember to stay healthy and safe until then. Wear a mask when interacting with other people out in the real world. Want more Skeptrack? Get more than 10 years of Skeptics Track programming at our video archive. video.skeptrack.org